JICA has taken various initiatives in order to contribute towards Sustainable Development Goals, or SDGs. Let's see how these goals are achieved through the theory of change approach. We'll introduce the idea of the theory of change using an example of the Maternal and Child Health Handbook. The Maternal and Child Health Handbook shows the health record covering the period from pregnancy up to early childhood. JICA has supported the use of this handbook in more than 30 countries worldwide. The final objective is to improve the health conditions of pregnant women, mothers, and their children up to 5 years of age. This also contributes to the SDGs. The box in the middle looks simple, but when you look inside, there are often complicated pathways with multiple factors to take into consideration. In order to plan and implement truly effective projects, we need to visualize what's inside the box, or in other words, the pathways of how development outcomes emerge. Here is the theory of change, starting with the health services based on the handbook, leading to the final objectives. The final objectives are written in red. Blue is for the pregnant woman and mothers, showing the chain of their behavior changes from left to right. One change causes another, just like dominoes falling. Gray is for assumptions, things that are likely to be accomplished naturally or with support from other organizations. Green is for preconditions that can be met only with certain actions. JICA implements projects in order to meet these preconditions. Now we will take a look at JICA's assistance in Angola. In Angola, a lot of social infrastructure, such as hospitals, was destroyed, and numerous citizens, including doctors and nurses, lost their lives due to 27 years of fighting that followed the country's gaining of independence in 1975. Many women still deliver their babies with no support from skilled birth attendants equipped with medical knowledge. The maternal mortality rate and under 5 mortality rate in Angola are rather high by world standards, although they are improving. In this context, Japan has assisted the Angolan government in developing and mainstreaming the use of their Maternal and Child Health Handbook nationwide. Let's see how it has gone from the start. Through use of the handbook, the quality of health services improves. JICA has provided support to make sure that health centers are ready with sufficient copies of the handbook by providing workshops on the distribution plan and inventory management. Angola is one of the countries with the lowest antenatal care coverage in the world. We need to ensure that pregnant women receive antenatal care for safe delivery. To do this, the project has disseminated information on the necessity of antenatal care through community health workers' home visits and car announcement. As a result, many pregnant women have decided to go to the health centers and have started building their confidence towards the health staff. We have heard so many positive comments from the women who received the handbook, such as there are many illustrations and it's easy to understand, or they can't read, but their husbands read it for them and they learn a lot. When there is better communication with the health staff and pregnant women's understanding on pregnancy and childbirth deepens, they tend to receive antenatal care continuously and improve their lifestyles. It is important to note, however, that in order to create a favorable environment for continuous care, there must be a convenient means of transportation and the family's understanding for the woman's absence from home, for example.
I'm glad I came to this clinic for my antenatal checkup. The doctors and nurses here are so helpful.
Continuous visits make it possible for the pregnant woman to receive much-needed care according to their own personal health condition and expected delivery date. Their improved lifestyles during pregnancy also contribute to maintaining their good health. It is important that the health staff record the maternal health status without fail and identify any possible risk factors so that the pregnant woman's health can be monitored properly. To ensure this, JICA supported training for the health staff.
I attended the training on the Maternal and Child Health Handbook. It was indeed a very exciting experience. I learned a lot from the training. Especially, I realized how important it is to ask about the mother's and her family's health history in order to understand her current condition. Depending on the pregnancy risk level, we can also decide whether to follow up here or refer the case to a higher level health facility. In general, the handbook is a very helpful tool for our work.
Greater trust in the health staff results in more pregnant women deciding to give birth in health facilities. All these processes lead to safe childbirth. It's been also reported that as a result of pregnant women receiving the Maternal and Child Health Handbook, their husbands tend to understand better and get more interested in pregnancy and childbirth. Getting the knowledge of childcare and support from the husband plays an important role in improving the health of babies and young children. Let's take a look at the flow leading to reduction in the under 5 mortality rate. In general, knowledgeable mothers tend to breastfeed, give their children nutritious food and clean drinking water, and make sure that they are vaccinated. These actions lead to the child's healthy development, disease prevention, and the improvement of their health conditions as a result. We considered it crucial to provide the women with opportunities to share their experience with one another, instead of just expecting them to read the handbook on their own. JICA has therefore supported maternal classes for mothers and their family members, as well as community education activities, in order to help them better understand childcare-related issues, such as nutrition.
When I received this handbook for the first time, I read it as soon as I got home. I noticed it had a lot of important information. The health providers take better care of my baby now, and her health condition is excellent. If there's any problem, I just run to the health center. I hope she'll grow up healthy and have a bright future.
The theory of change has helped us see the pathways clearly regarding how use of the Maternal and Child Health Handbook leads to the final objective of health improvement for pregnant women, mothers, and their children, as well as Sustainable Development Goal 3, good health and well-being. JICA has been cooperating not only in maternal and child health, but in a wide variety of other fields for over half a century. We will continue to select the most effective pathways of support through theory of change and contribute to achieving the development goals around the world.